there moved into um, more, neurodegenerative type symptoms, a lot of brain fog, a lot of dizziness, eye issues, memory issues. When someone is, you know, dealing with all these symptoms and at their worst, the last thing, they want to do a lot of times is try to, find someone who actually who knows how to work with them. One thing in space, it's very difficult for patients to talk to a provider typically before they start working with them, which is kind of crazy because usually, an initial appointment, this is all very different than, how medicine is typically approached in the United States.
They'll have some of them, they have a sign up on their wall in the treatment room saying that they'll only talk to you about one thing at a time. So if you've got one of these chronic diseases that's causing you like five different symptoms, like, oh, well, I have digestion problems and I have, nerve pain or joint pain and or headaches, or like, how do they do that?
I mean, all these conditions, that we've touched on are multi-systemic. So, to try to, think that you can get to the bottom of something in that, a short amount of time is
Yeah.
crazy. So a lot of triggers that can cause people to flare. And oftentimes in other clinics, and this has been, my experience and a co-founder's experience, if you're needing to see someone, even if you're a current patient, you often can't get in for, 2, 3 months.
But for somebody who's from North Dakota or Nebraska, maybe they don't have a Lyme disease specialist in their whole state. If there's, there might not be in North Dakota.
So it's a really nice way to, for patients to access services where they don't have to travel for hours and hours, potentially go to another state to see someone who can actually get help from, the comfort of their own home.